Hello and welcome to Filling the Sink, a podcast from Catalan News. My name is Beth Cohen and today we're talking about the medicinal use of cannabis. Cannabis has many nicknames: marijuana, dope, weed, grass and pot, amongst others. It consists of the dried leaves of the hemp plant, which can be smoked, chewed or ingested for euphoric effect. It is the most commonly used illicit drug in Catalonia and is considered a soft drug. This controversial plant has been used throughout history to relieve pain and aid relaxation. And in recent years, the medicinal and therapeutic properties of cannabis have been explored in the treatment of conditions such as Alzheimer's, multiple sclerosis, epilepsy, HIV and AIDS, to name just a few. But despite its proven medical benefits, the legal issues and social stigma surrounding cannabis may deter many patients. So joining me in the studio today to explore this topic further is Emma Monròs. Hello there, Emma.
Hi, hello, Beth.
How are you?
Good.
Now, Emma, you might remember that we discussed cannabis way back in episode 67 of Filling the Sink.
Yes, there we addressed the emergence of cannabis clubs here in Catalonia and talked about wheat farms that exploit legal loopholes to be able to sell their products abroad. But in today's podcast, we'll be exploring medical as opposed to recreational use.
Okay, so to ask a really obvious question, what's the difference?
Well, medicinal marijuana comes in the same form as recreational marijuana and can be taken in the same way. Sometimes, however, purified and laboratory-made versions are also available. But the main difference between medicinal cannabis and recreational cannabis are the levels of CBD and THC.
Okay, so just to clarify that, CBD stands for cannabidiol and THC stands for tetrahydrocannabinol. And that's right, Emma? No?
Yeah.
And they're the active ingredients in marijuana.
Yes, so THC, it's much shorter, so we'll be referring to it as that. It's a psychoactive and can make the user feel high, whereas CBD is responsible for the feeling of relaxation and pain relief associated with the medicinal use.
Okay, so I imagine that recreational marijuana probably has more THC content than medicinal marijuana.
That's right. The active ingredient of medicinal marijuana is CBD.
And what some of our listeners might not know is that hemp plants naturally produce both of these chemical compounds.
Yes, depending on the moment of harvesting, the chemical content of the bud varies, so growers monitor the plant as it matures for optimum results. If you harvest marijuana too early, there will be low levels of both CBD and THC. The trichomes are...
Hey, wait. Wait a minute. What's a trichome?
Okay, so trichomes are kind of drops of resin of the bud. So when the bud is young, these drops are still transparent. As the plant matures, the trichomes turn opaque or milky colored as peak levels of THC and other active ingredients are reached. This is when recreational cultivators will want to harvest. And finally, as the plant overripens, the trichomes start to turn amber. THC content diminishes, so this would be a good moment to harvest for relaxing and pain-relieving effects without euphoria.
That's fascinating. So it's the same plant, but you get different results depending on when the buds are collected, right?
Exactly, that's it.
Now, because of the medical benefits of CBD, I believe Spain's been developing a law to legalize cannabis. Emma, can you tell me a bit more about that?
Well, it is still not a law. The Spanish Health Ministry released a press announcement on the topic on September 30 this year, and what has been published so far is a draft of a royal decree that would allow this consumption.
A draft of a royal decree, so that's like a pre-law.
Yeah, exactly, that's right. So according to this draft, the only pathologies that could benefit from this are the ones where there is scientific evidence of the benefits of therapeutic cannabis that have been proven.
Okay.
And the use of it would be quite limited, as only specialized doctors could prescribe it. And the preparation has to be done in hospital pharmacies with a master formula. And in addition, there will be a register that enable the traceability and the quality of the pharmaceutical preparation.
So it's not just a general legalization, it's very controlled and it's all sort of through doctors and very specific.
But it is a draft. It still has to be approved and it's not the final text.
Okay, so we'll have to see what happens.
Exactly.
Now, despite the legal obstacles involved in prescribing marijuana to patients, it is an increasingly popular therapy.
Yes, I talked to Dr. Magí Farré. He's the head of the clinical pharmacology services in Hospital Germans Trias Pujol here in Badalona. And I talked to him about the effects, uses, benefits, and disadvantages of medical marijuana.
That sounds really interesting. Let's hear how you got on.
Sometimes it is difficult to fully comprehend the law without going into detail about what it allows and what it doesn't. So who will better explain it to us than an actual doctor with experience in the field?
Cannabis és una substància que està fiscalitzada per la ONU.
Cannabis is a substance that is currently controlled by the United Nations. It is prohibited in hospitals, although some medicines that contain the active ingredients of cannabis are permitted.
Els principis actius del cannabis.
So at the moment, the use of the plant or the buds of the plant is completely forbidden in Spanish hospitals. However, this may change when the new law comes into effect. The law would open up new possibilities in terms of permissions to use pharmaceutically prepared medicines based on cannabis, such as certain essential oils. If it were possible to prepare this in the hospital pharmacy, it would be easier for the patients as they wouldn't have to elaborate anything themselves and could guarantee an accurate dose.
Perquè seria el més fàcil.
It would be the easiest thing, because when you give a medical preparation straight to the patient, they can just pick up the finished product and it's ready to take.
Essential oils are one of the most common ways of taking medicinal marijuana, but Dr. Magí Farré also presents other options.
Per exemple, que una infusió poses...
For example, by preparing an infusion, you just have to weigh out the quantity of the plant that you need, add the right amount of water, boil it, and it's ready.
The law also delves into which patients should be allowed to use cannabidiol and what pathology they must be suffering from in order to qualify for this type of treatment.
I que les indicacions aquí a Espanya són indicacions molt limitades. Al final han posat algunes epilèpsies.
The medical indications here in Spain are very restrictive. The health authorities have indicated cannabidiol for some forms of epilepsy, but they might also allow cannabis. They have also considered permission for sufferers of chronic pain, which is a novelty.
Han posat també dolor crònic, que no millora, que això és una novetat respecte a tot el que he dit abans, esclerosi múltiple.
And also for sufferers of multiple sclerosis, and to alleviate the nausea and vomiting caused by chemotherapy. These indications are similar to those already established in other countries, but there is always an annex clarifying that doctors can prescribe it to patients with Crohn's disease, insomnia, and certain other conditions.
And how would patients actually benefit from changes in the law which allow this new medicine?
Avantatges i inconvenients que té?
It has different advantages and disadvantages, one of them being you can adjust the dose to each individual patient.
Jo crec que l'avantatge és que...
I think one of the advantages is that patients will be able to try a new remedy that right now is an illegal possibility. The patients who have tried it would have had to buy it themselves on the black market and handle what is considered an illegal substance.
Jo crec que aquesta facilita una miqueta.
I think this law will make it easier to get treatment to those patients who really need it. Cannabis clubs here in Catalonia do partially serve that function already. Substance abuse is prevalent in cannabis clubs, but it is also a place where a lot of people can get the cannabis that they need.
És el lloc on aconsegueixen aconseguir el cannabis que necessiten.
But as with other medicines, not everything works for every patient in the same way. Dr. Farré also explained the circumstances in which the use of cannabis is not recommended.
Tots aquells que han presentat efectes indesitjables.
It shouldn't be prescribed to patients who have previously suffered unwanted effects. For example, people who tried cannabis as adolescents and had a psychosis. Neither should it be taken by patients who have previously suffered organ complications when taking cannabis, nor by patients with a pre-existing psychiatric condition.
I complicacions psiquiàtriques tampoc. És a dir, una persona que de jove va tenir una crisi psicòtica.
For example, if someone had a psychotic breakdown when they were younger, you cannot prescribe cannabis because it could happen again. These are the main groups of patients who shouldn't take cannabis. It is also not recommended for people with high blood pressure or heart disease, as well as any kind of mental illness. In these cases, any use should be very closely monitored.
Aquest sí que realment es té que vigilar.
There is also the question of who can prescribe this medicine, as it is a narcotic, and it should only be taken under strict medical supervision.
O sigui, no tothom està capacitat, no? I això.
Not everyone is able to prescribe it. I think that when the law starts to be effective, a lot of doctors who want to treat their patients with cannabis will need to learn how to prescribe it, as it is something they have never done before.
perquè és un estupefaent. Els estupefaents requereixen...
At the end of the day, it is a narcotic, and doctors need to be trained and informed about it. It shouldn't be taken lightly.
There are many benefits that medical cannabis can offer for a patient, but there are also potential risks involved. These new therapeutic possibilities could become standard treatments in the future if the Spanish Health Ministry goes ahead with the proposed legal changes.
Thank you to Dr. Magí Farré for talking to us. Emma, I didn't know that cannabis had so many health benefits.
Yes, I was also surprised with this interview.
But of course, there are also negative consequences. I mean, obviously in the short term. For example, it affects the ability to drive and to operate machinery, no?
Yeah, and regarding that, there was also a study by the Hospital Clinic of Barcelona, which was published on October 26, 2023, so last year. And it showed that there is a higher risk for patients under 25-year-olds, as it can increase the risk of psychosis, so it wouldn't be as recommended. Obviously, every patient is different. And it is also not recommended for pregnant people, as it can affect the fetus. This is why the governments are being cautious about the legalization of marijuana, whether recreational or medicinal.
Calapa Clinic is one of the centres in Barcelona which specialises in medical cannabis-based therapies. There are a lot of positive testimonials on their webpage from sufferers of different disorders such as IBS, Parkinson's, migraines, back pain and skin disease. Let's hear some of them. Take it away, Emma.
Okay, so we're going to start with a testimony from Mari Carmen. She's the mother of a young boy suffering from DUS syndrome, which is a rare childhood form of epilepsy. She says, "Since we started the CBD treatment, my son has become another person. He's alert, has good reflexes, and responds well to stimuli. He's able to play with his sister and other children in the park."
And we have another testimonial from Lourdes, whose son suffers from the skin disease psoriasis. She says, "After using the CBD cream, I've seen that his wounds have improved a lot. I was afraid to use this type of treatment on my son, but I've seen that his skin has improved."
And we'll finish up with a quote from Dr. Ekaitz Aguirregoitia Marcos from the Calapa Clinic in Barcelona about using CBD-based medication for decreasing pain in sufferers of Crohn's disease. "As a doctor, I am convinced that we need to offer this treatment to more patients. I have seen substantial improvement in other people using this treatment, and I can see how effective it is."
There's some compelling testimonials there.
Yes, but let's remember what Dr. Magí Farré said. Cannabis can be very potent for patients who have never come into contact with it before, and it should always be taken under supervision from your doctor.
Yes, we mustn't forget that marijuana is a natural substance. It comes from a plant, just as opium comes from poppies and cocaine is derived from the leaves of the coca plant. The use of plant-based remedies is a complementary medical practice which is known as phytotherapy, which uses substances from plants to treat or prevent disease. But with unregulated production, the exact chemical content is difficult to control, and the effects can obviously vary.
One of the arguments in favor of legalizing marijuana would be the ability to monitor production.
So the submerged economy would be diminished if growing marijuana was regulated and no longer considered a criminal activity, right?
Exactly. Cannabis is still the most consumed drug in Europe. In fact, Spain is the state with the highest consumption in the EU, and 66% of cannabis confiscations in the EU are done in Spain, according to a 2023 report by the European Union Drugs Agency.
Yet we're always hearing on the news about illegal plantations being discovered and closed down.
Yes, the day before recording this podcast, the Catalan police dismantled 4 plantations of marijuana in different parts of Catalonia, and the day before that, it was 2 plantations. And just as we're recording this, the news has come in about the dismantling of a plantation with 5 greenhouses and the seizure of 5,000 kilos of product.
That's a lot.
Yeah. In Catalonia, police says harvest and arrest cultivators of illegal plantations at least once a day, sometimes even more. And in fact, Catalonia used to be a transit area for cannabis until significant production began about 10 years ago. Since then, the industry has boomed. Catalonia is now Spain's top cannabis producing region.
Emma, do you know why cannabis cultivation is being so successful in Catalonia? I mean, I'm guessing it's to do with the climate, right?
Yes, it's that and a combination of different factors. The police say that our European location and good connections play an important role. And there is, of course, the climate, as you said. Here in Catalonia, we have a Mediterranean climate, so it's hot, dry summers and mild winters. And the soil is also very fertile, so it's an ideal place to grow a lot of crops, including marijuana.
To find out more about legal cannabis cultivation, you visit Cannamedics, the first company in Catalonia with an official license to grow medicinal cannabis. And you spoke to owner and co-founder Luis Gomas about this groundbreaking enterprise. Let's hear more about it.
The pharmaceutical potential of cannabis may come as news to you. Perhaps you had never heard of it being used in a medical sphere. However, doctors and scientists have been collaborating for years on the development of therapies using the cannabis plant. One such example is Cannamedics, the first Catalan company to obtain a permit from the Spanish Agency of Medicine to grow cannabis for medical purposes. They are based in Monròs, a town just outside Barcelona. The company was founded 5 years ago by two brothers, Álvaro and Luis Gomas. In an interview with Catalan News, Luis told us more about the origins of the company.
We had, unfortunately, an accident in our family. Our uncle had a bad accident and he became paraplegic. After that point, he started different sort of treatments, and one of them was against the pain, the chronic pain he had from that accident. And one of the treatments involved opioids, and those kind of products, these kind of drugs, have very strong side effects. So once we had this problem in our family, we tried to look around for, I won't say alternatives, but for complementary aids, treatment or whatever that helped him to reduce that pain, or at least that dosage of opioids. And looking for a product or a treatment, we end up realizing that cannabis was actually something, but in Europe was not open at the time. A few months after that idea, the market starts to open in Europe as well. In Germany, in Czech Republic, United Kingdom, several states, several member states in Europe.
And after a lot of time and research, they decided to do the same.
We were allowed to, if we were compliant with several requirements, we were allowed to obtain EU GMP certificates in order to produce pharmaceutical products of cannabis and then deliver to those countries that allow the prescription of these kind of products for medical purposes.
But what does Cannamedics actually produce?
We produce unirradiated indoor medical cannabis flowers. So we basically produce the buds, the cannabis buds, but in pharmaceutical conditions. So we have to basically produce it homogeneously. So it has to be a standardized product, same concentration, 7 levels of concentration of cannabinoids.
The draft of the law presented by the Spanish Health Ministry opens a new door for companies like Cannamedics.
We know there's, a draft for this new regulation for medical cannabis in Spain. We are happy, like the industry here and all the groups of patients that can benefit from it are happy, of course. It's the first step, finally, right? A needed step from our politicians and from our health authorities here in Spain, finally, I must say. But we see that first step as quite restrictive, to be honest, because it's only allowing oils or extracts to be, as products, not flowers, not other type of products that have been, being used in several countries and are quite effective, actually.
But as we have mentioned, this is only a draft of a law that has not yet been approved and that some people still oppose.
We're facing many different challenges, politically speaking. We're even facing challenges socially speaking, because this product has been seen always, right, as a recreational drug. The way the product is being provided to the patient, flower, this is something, this in many countries, right, not here yet, but flower is something that crashes with what we are used to seeing in the pharmaceutical industry, right? But since it's working and it's helping many patients with their problems, we should open our minds a little bit and try to do our best.
Thank you to Luis for taking the time to share your story with us. It's clear that legal cannabis cultivation here in Catalonia is still in its infancy and that the legislation is constantly evolving.
Yes, and it's not just the legal side. Society still has a long way to go in terms of normalizing the medicinal use of cannabis. It is still widely known as a recreational drug and has some stigma attached.
But just to be clear, Emma, medicinal cannabis doesn't make you high, does it?
Experts say that the idea of medicinal cannabis is that it gives you all the benefits without any of the narcotic side effects usually associated with recreational use. And the way of taking it are different to those traditionally associated with recreational use. As we mentioned earlier, we're talking about essential oils, extract, tablets, sprays.
So not smoking?
No, of course not. Like, can you imagine a doctor encouraging people to smoke? I don't think that would ever work.
No. And in terms of social stigma, things are also changing, and cannabis consumption is increasingly normalised.
Yes, there are many CBD shops throughout Catalonia.
And there are also events. For example, Spanabis. It's an annual cannabis event that's been held in Barcelona since 2002. Here you can find products made from the hemp plant, such as clothes, shoes and cosmetics, as well as seeds and material for cultivation. And of course, products related to recreational consumption and, most importantly, medicinal use. It's the biggest cannabis event in Europe, and it takes place at the Fira de Cornellà.
There is also the World Cannabis Conference, which takes place at the same time, and it is a benchmark event in terms of sharing the advancements in the field and feature talks by scientifics, medical and political figures.
And one final curiosity, Emma, did you know that cannabis plants can be used to make building materials?
What? No way.
It's a material called hempcrete, which sequesters carbon from the environment. And hemp's also used to produce hemp plastic, which is a bioplastic sourced from hemp, which is not only biodegradable, but also recyclable.
Wow. Cannabis truly is a fascinating and multi-purpose plant, and I feel like we may be hearing a lot more about it in the future.
Yes, let's see what the future holds. Today we've talked with pharmacological doctor Magí Farré about the uses, effects, advantages and disadvantages of medicinal cannabis.
And we've also visited Cannabedics, the first company with a permit to grow medicinal cannabis here in Catalonia.
And that's nearly all we've got time for. But before we go, Emma, what's our Catalan phrase of the week?
This week is "Que bé s'està quan s'està bé."
Okay, so that means literally how good you are when you're good?
Yes, and we use it in moments when we want to recognize and be grateful that when you're happy and everything is going great, everything's well, because, you know, it is a privilege to be in that situation that we don't always have.
So you really recognize when everything's going well and You're grateful for it. Well, I think that phrase is a great wrap for a program about health and well-being. Thank you so much for listening. Make sure to subscribe to Filling the Sink wherever you get your podcasts if you haven't done so already. Thanks to Magí Farré and to Luis Comas for speaking with us. And thanks to Emma Monròs for joining us here in the studio.
It's been a pleasure.
We'll be back again next Saturday with another exciting episode of Filling the Sink. On behalf of the team here at Catalan News, I'm Beth Cohen, wishing you a great weekend. Fins aviat. Adeu.